Good morning, Lee Ankrum here from the Ankrum Institute. So let's talk about why it is that everybody, and I think I've talked about this before, but I'm going to give it to you again because you can never hear some of this stuff enough. Why is it that most people have low back or neck pain? And I'm just going to make it totally simple. You're looking at the skeleton. I have a hard or solid head. I have my neck. I have my whole thorax, which has ribs and everything coming to the vertebrae. I have my lumbar spine, my low back, and then I have my pelvis, which is two hip bones and my sacrum together. Now here's the deal. When you look at this, look at how the two empty places with a lack of support are my neck and my low back. Okay? And that is one of the biggest reasons why, is because they're out there more vulnerable. And because they are not locked in, these two areas will adapt to something happening anywhere else in the body. I can have something going on in the head, okay, which is super common, and have it go down and into my neck, which I can't even tell you how much neck pain is about what's happening in the head. You can have stuff going on in either with the ribs, these vertebrae, or inside the whole cavity with the lungs or the heart, and it'll drive right down and into the low back and create low back pain. Of course, as you've seen in my other videos, things can happen in the pelvis. You can have things going on, tailbone falls, you can have hips in different places. Where are you going to really feel it? You're going to really feel it in your low back. So I could have things not working right in my feet or knees, and what can happen is that I'm going to feel them in my low back and my neck. So just looking for the problem where you're feeling your pain pattern is limiting. It's a limiting view that won't allow a real process back to health where you're not in pain, if you get my gist. Okay, thank you guys.